In the summer of 2009, students from Greene County, Georgia joined with a group of faculty mentors sponsored by the Night Share in Health and Medical Journalism. Along the way, the students learned health reporting skills, and they learned about the nature of health in their families and their communities. The journalists started their reporting close to home by interviewing family members about their health.
What kind of disease or illness do you have?
I have a heart disease. I have a back where disc is out of place. I have damaged nerves in my back and legs.
Tell me about your health problems.
I have diabetes. It's type 2.
Tell me a little about that.
Diabetes is where I have to watch what my sugar intake is. My pancreas cannot absorb all the sugar intake. Can't produce the things that break down sugar.
I have high blood pressure and bad arthritis.
Okay. How do you feel with your sickness?
I feel weak, drained, and uncomfortable.
How does your family health affect how you care for yourself?
I kind of like to make sure I stay healthier as far as eating, try to eat better. Watch what I eat. I get myself checked, go to the doctor.
How long have you had your sickness?
About 10 years.
How often do you go to the doctor?
Once a month.
How often do you have pain?
All the time.
The journalists were able to find out how the illness of one family member affects the rest of the family.
What would you change for better health in your family?
I think that I would change the time to promote better health. In my family, my husband is a school teacher and he also coaches, and then when I'm at work I'm very busy, so a lot of times that lends ourselves to bad health habits, just to grab something quick to eat and not taking time to exercise. So if I could change something, I would change the fact of not having enough time to promote good health.
Would you say that your family is healthy or unhealthy?
Unhealthy.
Why or why not?
Well, I would say they were unhealthy because my family would be unhealthy because they don't do a lot of exercise, and they don't eat a lot of healthy meals all the time.
Does this affect the whole family, or does this just affect you?
Well, it would affect the whole family, I would say.
Do you think that alcohol and drugs and smoking are a bad habit to get addicted on?
They are very bad. I did drink, but I didn't have a problem stopping 33 years ago. I do smoke now, and it is bad. It is a drug. I have tried everything that anybody has told me to do to stop, but I have not been able to stop, and if anybody has a suggestion, I'm willing to try.
Our citizen journalists then talked with community health professionals about health in Greene County.
Yes, my name is Debbie DeRuga, and I am a certified family nurse practitioner. And what that means is I'm a registered nurse that went back to school for further training and education so that I could diagnose and treat minor illnesses. My job is to basically assist the physician in taking care of minor health problems so that he can take care of the more critically ill medical problems.
Can you tell me about the practice you work with and what type of services you provide here?
I work in a Tender Care Community Health Center. It's a rural health clinic. We have medical, dental, and even a daycare. We also have a pharmacy here. And we basically see patients anywhere from babies all the way up to older patients. And we cover diabetes, hypertension, female problems, a little bit of everything.
Since you've been at Tender Care, what was the biggest health problem you had seen with young people?
Decay. Doing restorative work such as fillings and cleaning.
So that's the biggest problem for youth. What about the adults?
The structure of their teeth are really broken down, and they need a whole lot of restorative work, and they get put in a situation where you can't restore the teeth, and they have to be extracted. And majority of older adults have to have dentures and partials to replace their natural teeth, because most of them are not reconstructible.